Interesting developments have taken place, but we begin by touching upon what happened in the mid-19th century during conflicts that took place between the British and the French on one side and China on the other side. Now, these wars today are known as the Opium Wars. What happened was between 1839 and 1860, British and French forces effectively forced opium they had cultivated in Bengal and Turkey onto China. This led to the development of China's infamous opium houses, and despite efforts from Chinese authorities to ban the use of recreational opium, by the time this war came around, the trade was too profitable for the British and the American merchants to let it go, and it created a major opium crisis in China, because by 1833, Chinese opium trade had risen from 4,000 to over 30,000 chests, weighing 77 kgs each. The Opium Wars had a crippling effect on the Chinese economy and saw the imposition of quote-unquote unequal treaties, where Britain and France effectively gained exemption to Chinese laws in China, alongside massive fines for China's attempts at stemming the opium business. Today, however, the shoe is pretty much, it seems, on the other foot. This on your screens that you see, viewers, this white powder is called fentanyl. It is a synthetic opioid drug used as an analgesic for pain relief and anesthetic, and is also included in the national list of essential medicines since 2022 for use in hospitals and medical colleges. According to the US Drug Enforcement Administration, it is approximately 100 times more potent than morphine and 50 times more potent than heroin. A 2022 study by the Georgetown Behavioral Hospital, using data from the drug watchdog Families Against Fentanyl, shows that fentanyl is the leading cause of death amongst Americans aged between 18 to 45. Above both, in fact, suicide and COVID-19. So fentanyl actually the leading cause of death. According to the federal data, nearly 110,000 people have died of drug overdoses in 2022, and fentanyl holds the top spot, accounting for some 75,000 deaths in 2022. Now, illicit fentanyl is ravaging populations in the West, and guess who is then the leading manufacturer of fentanyl today? It's China. Today, however, we're talking about another group of synthetic opioids called Nitazenes. Nitazenes were developed in the 1950s and as an opioid pain relief medication, but they were never approved to the market. Nitazenes, according to the DEA, are being circulated in the United States, mixed into other drugs like heroin, and are primarily being procured from China For comparison, however, nitazenes are nearly 300 times more potent than heroin. And mixed with heroin, they have the potential to kill people through an overdose. Since the first instance of detection in 2019, it is the UK which is now finding nitazene mixed in everything from cannabis to heroin to black market pills like Diazepam. People are seeing adverse symptoms, with one even reporting holes in her flesh after she consumed medication cut with nitazene. All of this arises from the ban on opium manufacturing in Afghanistan and the gap left in the market by a country that till now supplied up to 90% of the market for illicit opioids. Chinese chemical manufacturing companies have effectively plugged in that gap, and as a result, nitazene is finding its way into drugs in the West. A proxy war clearly is at hand. What in fact happened to China in the 1800s is now returning and biting both America and the UK in terms of fentanyl and nitazene, which is a drug that is even more potent than fentanyl. What does this mean? And how do we then protect ourselves from what could possibly happen? We take this conversation forward with Dr. Sanjeev Bagai. We also have with us Dr. PSV Rao And we have with us Professor Madhav Nalapat and Vijay Kranti as well. Let me begin with Dr. Bagai. Dr. Bagai, we've tried our best in terms of explaining to our viewers what exactly is this new potent drug, Nitazene. But if you can shed some light on the same as well, sir. When exactly did this come about, and what really is the medical community then discussing as far as this particular drug is concerned?
Good evening to everyone on panel and all the viewers. First of all, I want to thank the channel for actually bringing this topic up, which is of huge social significance. Drug overdose and drug abuse in India is not unknown. In the last data, we have about 63 million Indians who abuse alcohol, 9 million who abuse cannabis, 2 million who abuse opioids, and 1 million who abuse hypnotic drugs, psychotic drugs. This is a huge number, and this is what is documented. Unfortunately, a lot of drugs which are included under the group of opioids, which are psychostimulant drugs, these are banned drugs in the open market, are readily available. And these include a host of drugs, including fentanyl, morphine, codeine, methadone. Tramadol is a painkiller which is routinely available. Actually, it's a scheduled drug, but it can be available across the counter without a prescription, unfortunately. And indeed, heroin. Now, this new drug known as Nitazenes is a highly potent drug. It is metabolized very quickly and it has a very slow release from the body. Therefore, the chance and the window, what we call as of toxicity, is very narrow. It is approximately 1,000 times more potent than morphine and 10 times more potent than fentanyl. And fentanyl itself can kill people. If it is 10 times more, you can imagine the lethal toxicity. These are designer synthetic analogs. And what they do is they actually decrease the respiratory cycle in your chest and cause respiratory depression. So your breathing gets obliterated. It decreases the blood supply to your brain to cause cerebral hypoxia and long-term and short-term mental impairments. Now, the opioids actually work at a site in the brain known as MAO receptors. These are receptors, enzymatic receptors, which bind on to the opioids, which cause these kind of abnormalities of physical disability, mental disability, cognitive impairment. And there is a sense initially of euphoria. There is a feeling of adolescents or children or adults, young adults, on all age groups, of feeling invincible. You lose track of time, space, and person. You get disoriented. And what this actually does is it has 3 active metabolites. These metabolites, I won't go into the biochemical details, but these metabolites harm the brain. Fentanyl has a half-life in the body of approximately 1 hour, 67 minutes. Unfortunately, this new drug, Nitazene, has a half-life of 210 minutes. That means it can linger on in your body for 3.5 hours, which can indeed be fatal. Coming to the ground reality, there is a lot of availability through drug peddlers, not only in Bombay or in metros, but even in smaller towns. Punjab is a case example. In pubs, in nightclubs, and often this is abused with other stimulants or depressants, like with alcohol, and this is often mixed with other drugs to cause a cocktail kind of effect. So I think we need to bring awareness. Then it should be a public campaign. Drugs kill. It's as simple as that. It destroys the life completely, not only of the index person, but of the entire family. It causes physical disability, financial crisis, and very often the de-addiction really may not work. Over to you.
Okay, Dr. P.S.V. Rao, what exactly were some of these synthetic opioids like fentanyl or even this Nitazene? What purpose are they being created to serve? Or is this now a drug that is being created for quote-unquote recreational use, which is now finding its way into people's systems through the black market?
Good evening, Deepika and all panelists and viewers. See, this particular group is not a single drug. It's a group of drugs, Nitazenes. And these were discovered initially in the 1950s. It's not a new drug. It's an old discovery. But finding that it is very potent, and very toxic. If means in overdose, and difficult to manage the overdose, like Dr. Sanjeev Bagai highlighted, because of its long half-life. These drugs were not allowed for pharmacological use. These were not allowed into the market. Morphia and many other opioids are officially permitted, but they are under strict regulation and under drug control, and their usage, everything has to be made, a record has to be kept, how much has been supplied, for whom it has been used, how much it has been used, to avoid any use of these for drug recreation and drug activities. And like we have already, Dr. Bagai has already mentioned, these are highly toxic and can cause both temporary and permanent, both mental and physical disabilities. And this is the reason why these are not to be used, and these were banned. Now what has happened, like you have already mentioned, the Taliban has drastically reduced the supply of heroin. Now the other problem with heroin, cocaine, etc. is that these have to be smuggled and they become extremely expensive by the time they land up in the US or in the European or UK markets, in the Western markets or any other market. So what has happened is illicit drug manufacturing has started off. And you know who is the leader in such things. Anything illicit, anything cheap, anything poor quality, it is our neighbor in the north, China. And large numbers of not only fentanyl, but which is being supplied, but even these drugs. And some of them are officially, like fentanyl is also officially sent. It is also unofficially sent through drug syndicates in Mexico and other places to US and to Europe. So this is the problem. Now, as far as the doctors who have to see this and manage these patients, the problem is that very often there is a mix-up of multiple opioids, hallucinating agents. It is not pure heroin, pure cocaine, pure one of these drugs. So when the patient who lands up in the emergency, he or she comes totally comatose or is unconscious. He is unable to tell you what is happening. Now the doctor has to now first figure out that this is a drug overdose. They have to figure out which are the cocktail of drugs which have been used. And many of these drugs, we don't have ways of testing it. And we have standard 2 drugs which are opioid antagonists. And the more popular one is called naloxone. So it can be used, but then how do you know how much, which drug has been taken? What is the dosage which has been taken? And the other problem is, since these are all illicit manufacturing and illicit supply, there are a lot of impurities. See, to increase the profit, they will put other substances in it, maybe other hallucinogens, or maybe other toxic stuff in it. Now the problem for us doctors is, you don't know what all toxins are in the system, how much it has been taken. So this is a big, huge problem. And even if you manage to get this unconscious or person who is in depression, in a sort of comatose state, out of this, then the rehabilitation, and the treatment of the various physical and mental disabilities, this all is a huge thing.
Absolutely.
A term was put for this called toxic brain injury. So these are toxins, brain injuries, and with a huge problem for everyone now concerned.
Okay, Professor Nalapat, these are very worrying developments that are taking place in the US and the UK also now reporting about it. The fact that fentanyl kills over 1 lakh people in the US, or it has at least in 2022, is an extremely worrying sign, because perhaps where we are going wrong is in our assessment of where the next wars will take place. We're thinking that these wars will happen on our borders or in the seas, but the wars are actually happening through all these other means. If we're talking about biological warfare, that doesn't restrict itself to a COVID-19 outbreak or to people going to China and suddenly developing symptoms that are like pneumonia and some sort of a rare disease again. It's simply these drugs making its way into our markets and then misguided youth and other people consuming them.
Well, Devika, you're perfectly right. And the reality of the situation is that war is a state of existence in which the population is severely harmed, whether the civilian population or the population uniform the population. And there can be war by many means. You can have war through a bombing, you can have war through artillery, through bullets, which is how we normally define a war. Or you can have a war by stealth. And unfortunately, in China, war by stealth is the preferred option. Incremental expansion that may create a reaction. So exactly as the drug has an effect of basically lulling you into a false state of, in a sense, unconsciousness about what is really happening to you, the method of warfare adopted by the CCP is to lull you into a state in which you really don't know that you're at war. And in fact, you become inadvertently one of the great supporters, if I may say so, of the very country that is making war on you through boosting its coffers, through buying all kinds of products legally, while they flood you illegally with this kind of drug. The reality is the CCP has very good control in China. The tongs, the gangs in China, almost all of them are basically eventually controlled by the CCP and used by the CCP in its hybrid war planning and in the execution of these plans. So what we are seeing is basically a state of war in which these countries are now facing the brunt of an epidemic which could easily be controlled if the basic chemical supply were controlled, and that could easily be controlled by the CCP. The fact that it is uncontrolled indicates that it is policy to ensure that these drugs continue to be sold and at the same time smuggled long distances. There again, it cannot happen without facilitation. And facilitation not just in China, but facilitation through those who are linked to the Chinese, to the communist Chinese system of doing something for profit in other parts of the world. For example, South America. For example, the US-Canadian border, the US-Mexican border. Both these borders are in fact very porous, and unfortunately, Canada in particular, there's a very significant degree of CCP influence in Canada, and we have seen that play out in its reaction to India. So what we are seeing is a state of war. And yes, I think society has to be warned about this war, society has to be prepared about this war, and yes, governments need to take active steps on this. Now, Mr. President Biden thought a friendly conversation with Mr. Xi will settle the issue. He was completely wrong. The fact is that friendly conversations are what the CCP is expert at, because that is part of how you are lulled into a false sense that you have solved a problem when actually the problem is multiplying in front of you, only you're not conscious of it. So I'm delighted that NewsX has been the channel that has drawn attention to this, something that has been welcomed by both our very eminent and distinguished doctors on the panel.
Absolutely. Mr. Vijay Kranti, bringing you into the conversation as well and just taking forward what Professor Nalapat has said. When we then talk about nations raising certain alarm bells over this entire matter, which is really, you think that it's happening in the back alleys, that it's not going to end up affecting populations at large, and then you end up having states that come to be known as the drug capitals of your country. We've seen that happen in India, and I don't want to name any particular state, but there will always be this threat that looms large, and it is directly in a way attacking your youngsters, your youth, their health, and also their lives. The way that several leaders of the world came together to raise alarm, to talk about the threat of artificial intelligence, to talk about the threat of deep fakes in this world. Do we then, as India perhaps, do we now need to be the nation that probably brings the world together once again to discuss this very important aspect, this very important matter of drugs like fentanyl and other drugs like Nitazenes making its way into our markets?
Devika, the problem is that those who are victims, those who are targets of this attack, which is a very, very fatal attack from China, none of them or their institutions are willing to take China head on. Everybody knew what happened in COVID. Everybody was sure how the virus traveled in a very organized way from China and went across the whole world within a couple of months. Everybody knew it, but nobody had the courage. Other institutions, we are responsible for handling these kind of sessions and provide sorry to this. And the world was expecting WHO to take lead, point out the real problem and the source, and tackle it. So almost the same thing happened with the governments. None of the government, not a single government, raised voice directly against China. Everybody was afraid. Every government, or rather those very, very influential governments, unfortunately, those governments like America or many of them, they don't function as political groups, or they are functioning on behalf of what you call corporates. And they are looking after first the interest of their corporates and then the interest of their own nations, and leave aside the interest of rest of the world. So we have seen how the world ignored China and allowed it to go scot-free. And China's now, the President Xi Jinping's is now feeling much, like a bully. He is encouraged by that indifference. And let us not forget, China is running on the basic theory of becoming the middle kingdom. And unfortunately for the rest of the world, and very fortunately for China, the economy of China, the military power of China, the political influence of China has gone so high over the last few decades that now its leaders, especially men like Xi Jinping, they feel that now it is time to implement, to take China to that level. And for that, they have no shame of using which method. They have no moral barriers. They don't have any moral standards to follow. So that is why how they are doing it. We have seen India has been a victim of China's drug war. The way they have been funding terrorist groups, separatist Indian groups, through not only military training and weapons, they have been supplying drugs to these groups so that they can raise funds on their own to run amok in India. So today we find that, if I say it in short, the Chinese thinker, the war thinker, Sun Tzu, his philosophy was that you should win the enemy without a fight. Go inside the home of the enemy and occupy it from within with the help of its own people.
Yes.
And this is exactly what China is doing. And all this drug war, today we are seeing the report has come from UK, or it is happening in America. Maybe this is going to happen in all those countries which are significant as far as China is concerned, who have to be lulled, who have to be, to made docile. And
Okay.
I think this is only a second chapter of Chinese attack after COVID. There may be many more.
Okay.
I'm sorry. This is what is happening.
Okay, I'm going to leave the last question to Professor Nalapat and our esteemed doctors on the panel as well. Professor Nalapat, then what is it that can be done? Is this a matter that then needs to be raised on a global platform? And I'm not talking about the UN, but several other platforms where leaders come together. Is this something that India then very genuinely needs to raise? Because we've just seen a massive coming together of global leaders to discuss the threats of artificial intelligence. What is then stopping us from discussing the fact that there are these deadly drugs that are making it, that have already made their way into the US, into Europe, and what's going to stop them from coming to the rest of the world?
Devika, I'm quite sure that the government of India has been talking privately to significant governments. Before you treated a problem in a patient, you first diagnose the problem. Unfortunately, the problem is that, as Dr. Vijay Kanti very correctly said, people are refusing to diagnose the root of the problem. Now, look at the way China developed relations with Afghanistan. Look at the way China has gone deep into Myanmar. Look at the way that China is so active now in basically in parts of Central Asia. Wherever you have the, again, if I may say so, parts of Asia, the extreme west of Asia. And all these are locations where drugs pass through into United States, into Europe, from Europe to the US or directly to the US. And all this is done for a purpose. And that purpose is hybrid warfare. Now, after all this evidence is presented, if nothing is being done, then I think the only way out, frankly, is for essentially the public to be given the information they need to come to their own conclusions. Let me remind you, till today, I can tell you officially, WHO said nothing about the origins of COVID. They talked about an animal vector. They haven't found the animal because the animal doesn't exist. It was produced in a lab, but nobody, officially talked about it. But everybody knows it, and this why? Because all the facts started tumbling out through scientists and through experts. In the same way now, scientists and experts like the two distinguished friends we have on this panel, they need to talk out and they need to name the problem, name the source, and shame their governments into acting. And in this, I can tell you, I'm very certain Government of India has been working very hard to give the evidence and to ensure that a united front is formed. Because unless you have a united front, there will not be success in a war. There's no point declaring war in the absence of success. In 1971, the war was launched when India was ready, about 7-8 months after a decision was taken to go to war. In the same way, we have to build opinion in different countries, talk to the leaders of different countries, so that there's a united front against this form of hybrid warfare.
Okay, all right. I have a minute or so left. Dr. Bagai, Dr. PSV Rao, I'll leave the last words with you, sir. Dr. Bagai, starting with you, 30 seconds, sir.
Yeah, what's important here is to understand and globally recognize that China is an opaque, sinister, and a very, very necrotic society. COVID was one issue. We also have now a mysterious pneumonia infections in young children and young adults, and still the origin is not known. WHO is a compromised organization. We've known that for a very long time. But I think what is within the Indian diaspora, I think apart from very, very strict laws and implementation is the key. I think at a grassroots level, subjects of abuse of drugs and substances, side effects should be highlighted right from high school going on to college and universities. There should be a print and electronic sustained media campaign as a public awareness without bias to highlight these issues. And that's why I said first off, I'm extremely happy that NewsX is the first channel to pick this up and highlight this. Over to you.
Okay, all right. Dr. Rao, I leave the last word with you, sir.
I think we should take heart from the way the tobacco consumption has come down. So we have to fight it at multiple levels. The international effort has already been discussed. We have to also take care of creating awareness like we did with tobacco and making it bringing in a lot of social pressure on all younger people other than educating them, also bringing social pressure to put an end to the drug menace. The drug menace is also connected with the alcohol abuse. So we will have to tackle both alcohol and drug abuse together. And we have to do it very fast before a whole generation is lost to drugs and alcohol abuse.
All right, I've run out of time, but I thank all of our panelists for joining us on the broadcast on this very, very important issue. And of course, we will continue to track further developments.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.